in the intense world of medical emergencies.
One patient, 3 times stab wounds.
There's nothing more extreme than a Code Red.
It's a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
PTO 4 minutes.
By road
It's a shooting of a male currently being shot ahead.
and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
This is going to be tight and painful, OK, but it's going to save your life.
day and night.
All right, well done.
From car crashes to stabbings.
He's been hit and stabbed in the head.
Here, where time is critical, lives will be saved.
Everyone clear? Yep.
These emergency doctors and specialist paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
I suspect we are going to be cracking open the blood products en route.
Female casualty.
Filmed alongside the critical care teams, we captured every vital second as these specialist crews work to save lives.
1, 2, 3, roll.
Tonight, a man's detached his scalp by hitting his head in a fall.
Sharp scratch.
A pensioner fights for his life.
Blood pressure reading failed.
Failed, OK.
I can't find a carotid pulse. I think I'm going to declare cardiac arrest on.
A drug user's taken an overdose.
Oh, there we go. Hello. How are you feeling?
And a mother gives birth in the foyer of a tower block.
Mum, how are you feeling? Other than a bit shook up.
It's the weekend,
Just got to check the ventilator, Ewan.
and Dr. Ewan Davies and paramedic Peter Bowles are starting their shift.
So this is the ventilator. We go through a quick checklist. So this will continue for 60 seconds and a little beep. That's done. This is like a simulated lung.
Cool.
Satisfied their kit's in order, they're ready to attend life-threatening emergencies across the West Midlands.
Chop, chop.
Yeah.
You're good to go.
Ambulance service, is the patient breathing?
Yeah, he is, yeah.
Are they conscious and awake?
Yeah, but he's had a nasty bang to the head.
Okay.
He's been out drinking with his mate. He's come back and he's hit his head, but it's like a massive chunk out the top. I think he's hit it on the corner of the cabinet.
How old the patient?
74, I think. I live with him.
All right, sir. Have you lost any blood?
Yeah. There's blood everywhere. It's bad. Every time he moves, he's squirting out.
All right, we have got some help arranged, okay? We are on a blue light emergency. Now, you have to stay with the patient until the help
I'm
arrives.
here. Yeah.
We are coming as soon as you possibly can.
An elderly gentleman has fallen and cut his head. When the first ambulance crew on scene request backup, Peter and Dr. Ewan are dispatched.
We've been tasked a request from a crew to go and give him a hand for a patient who's had what sounds like a serious head injury.
Head injuries can pose multiple risks, from concussion or a skull fracture to excessive blood loss. The critical care team's advanced skills are needed.
Yeah, that's all received. We'll keep you updated. Thanks, matey.
I'll go in here, look.
When Ewan and Peter arrive, 2 ambulance crews are on scene.
How are you guys doing? You okay?
Yeah.
Yeah, good. Thank you.
The patient is in an upstairs flat. Retired construction worker Roy fell nearly an hour ago, hitting his head on a cabinet, causing a large gash.
It's just pouring.
Paramedics have attempted to dress the wound, but have been unable to contain the bleeding.
Probably the width from here to here, and in the centre, it's a lot wider.
Up to the crown.
It's just split open, is it?
Yeah.
Hi Roy, my name's Ewan, I'm one of the doctors with the ambulance service, alright? We need to have a proper look at this wound and see if there's anything we can do to stop it bleeding, okay? Do you take blood thinners, Roy?
There's no blood in it.
No. His blood pressure's been fine.
He's been a bit confused, is he?
He's intoxicated.
Yeah.
Roy is acting confused and is only partially responsive. This could be an indication of brain trauma from hitting his head.
No other injuries at all, we're happy, we're not missing anything else, so
He's
we...
been complaining of feeling quite sick, but he hasn't vomited.
Bless you. Having a miserable time, Lee.
Is he on his own in this flat?
He was with a friend.
Ewan and Peter need to take a closer look at the wound, which will mean removing the existing dressing.
You can't grip all of it,
Yeah,
so
okay.
every time you release a certain part, the clots break off and
Okay.
it starts bleeding.
Yeah, okay. So I think if we're going to pull it off, we need to get sutures and stuff ready, just in case to... Okay, to you guys, yeah, seeing it doesn't seem, you seem to have done a good job of stopping for the time being, and then I think at the moment he looks as if he's all right to go to the truck, isn't he, do you think?
A fresh dressing is containing the bleeding for now, so Ewan opts to get Roy into the ambulance first.
Oh, ready, steady, roll. Speed a bit.
The board's just going behind the back.
Roll again, ready, steady, roll.
As Roy is unable to stand up by himself, he'll be carried on a scoop stretcher.
Okay, so if you put your knees to the board then, I've got the hips and the shoulder on this side.
Ready, steady, slide. Up.
There we go.
How you doing there, Roy?
It's bad.
Yeah, it is.
Ambulance service, is the patient breathing?
No, he's not breathing.
How old's the patient?
40 odd.
Male or female?
Male.
Is there a defibrillator nearby?
No.
Okay, so I'm going to tell you how to give life support. I need you to lay the individual on the back. Can you do that for me?
Yes.
I need you to kneel by his side, put one hand flat in the centre of his chest, okay? Put the other hand on top and lock your fingers together. I need you to push down hard and fast. So 1, 2, 3, push, 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 push. We've got some help arranged, okay?
A person who has stopped breathing has only minutes to live. Just a few miles away, critical care paramedic Ash Mullinder, Dr. Hadassah Eilenfeld, and trainee Dan Reed are immediately dispatched to the scene.
We are going to somebody who's been classified as a cardiac arrest, a 40-year-old in a block of flats. That is all we know at the moment. But at the age of 40, general things running through your head is, have they got a cardiac problem? Are there any sort of drugs on board? Have they got a clot that's causing the problem? Or is there some trauma involved that nobody's seen? Dan, do you want to, when we first go in, do a quick airway? Are they breathing? Have they got a pulse?
Yeah, happy with that.
I suggest, given the flat number, we just take up our equipment anyway. It's going to be easier to lug it all back down than to run up and down several times.
There we go.
You have reached your destination.
The patient is 14 floors up a tower block, making the logistics of the job more challenging.
Oh. Get through the door. I do rather remember the book again, am I? Thank you, Trey.
You will not get a
stretcher in here. Looks like we're taking the stairs.
The team finally arrived 15 minutes after the 999 call.
Hello. I'm just going to drop that there for a second.
The patient is lying unconscious on the floor. Paramedics suspect a drug overdose.
So you come off the sofa onto the floor.
Yeah.
Just smoke heroin. I've given one Narcan IM.
Yeah.
We're loading up a second dose now.
Okay.
The man's been given Narcan, a medicine which reverses the effects of opioids.
Sats are about 20% on air, respirator 8, and we've been bagging it.
The patient is not in cardiac arrest as previously thought, but his breathing is perilously slow and weak.
Excuse me, are you his friend? Okay. Has he taken some heroin this morning? Yeah.
Drugs deaths in the West Midlands have reached their highest ever level, with more than 200 fatalities a year. The patient's friend denies he took anything before collapsing, but paraphernalia around the flat suggests otherwise.
His main issue at the moment is heroin breathing, so definitely making some effort.
Paramedics are using a ventilation bag to pump air into the man's lungs and assist his respiration.
Since he's quite big, we need to round his shoulders up a little bit more. So if I lift his shoulders forward, can you pop the...
I wonder whether that beanbag might be useful, might get him into a really good position, as just as a thought, the big beanbag behind. I'm just thinking to get him as upright as possible, just because he's got quite a bit of weight on his chest. If you want to lift, I'll slide in behind you.
Dr. Hadassah hopes changing the man's position will help to open up his airway.
You need to just come out and stay out for us.
Okay then, buddy. All right.
If the man's breathing doesn't improve soon, his body will start to be deprived of oxygen and his heart could stop.
On then, ready to set then.
Okay, I'm going to don just so I can give you another pair of hands.
What is the story with him?
He's felt a bit giddy, collapsed, insufficient respiration. He's known to smoke heroin. He's just had a second dose of Narcan. He's had a bit of supported respiration.
It's thought the man has overdosed on drugs.
I know everyone already has, but obviously just be mindful where you're kneeling. We have got some used needles.
The patient's been given Narcan, a drug which reverses the effects of opioids, but he still hasn't regained consciousness.
Are you getting any resistance on the back?
No.
There's no gurgling.
Once in COVID PPE, Dr. Hadassah is able to help paramedics assist the man's breathing with a ventilation bag.
So we've got good misting, we've got good chest rise,
We've got good CO2.
and we've got good CO2. So as a two-person hold and a one-person bag, it is working.
Is he coming round more with that Narcan? Is he more responsive? Okay. So how much Narcan are we going to try and get through to try and...
We've given 3 lots so far.
3 lots.
Dr. Hadassah and Ash want to get the man into an ambulance as quickly as possible, but it won't be easy.
He's a big chap, so my proposal for extrication, please someone shout if you disagree. Striker, strap him in on the striker, so if he does wake up and start kicking off, he's strapped in. Use the back of the striker where the handle is just to strap his head to it.
Sounds like a good plan.
Anyone disagree with that?
No,
Are you happy?
The man weighs roughly 20 stone. The plan is to get him into a carry chair and lift him downstairs, conscious or not.
Oh, there we go. Hello. Hello, buddy.
Yeah.
How are you feeling?
Honestly.
The Narcan is working, and the man is finally coming around.
Have we still got a cannulation pouch somewhere?
Yes.
I'm going to try and get some IV access before he wakes up too much, and then at least we've got something other than IO for the route.
Dr. Hadassah wants to cannulate him to make it easier to administer drugs or fluids while he's moved to the ambulance.
Stay still for us, buddy. You're just with the paramedics, mate. All right, you're okay. Just stay nice and still for us. You're okay. You're just in your mate's house.
Nice and still for me, buddy. Sharp scratch coming in your arm. Well done. I think what we're going to do is make him sit up.
You're at your mate's house.
You've had a bit of an overdose. Buddy, look at me. My name's Hadassah, I'm one of the doctors. Now, you've had a bit of an overdose, you took a little bit too much and you stopped breathing. So we've had to do the breathing for you, and we're going to get you sat up a little bit and you'll feel a bit less confused afterwards, okay?
As well as helping him to get his bearings, sitting the man up will make it much easier to get him into the carry chair.
If we help you, do you reckon you can sit up for us? Yeah, we're going to give you a hand to come and sit up because you're going to feel a bit better sat up. We're going to stop there for a second because your blood pressure's quite low, you did collapse. I know you're feeling quite sleepy and confused, that's normal, okay? You're safe, we're going to look after you, all right?
Moving the man too quickly could cause him to pass out again. But Dr. Hadassah wants to get him out of the flat before the latest dose of Narcan wears off.
It's going to pop you up and get you on this chair, mate. All right.
We're going to need you to stand up, okay?
Pop your hand behind my arm there, mate. 1, 2.
Still semi-conscious, the man has little power in his legs.
1, 2. That's it. Pop yourself down. Strapped in. Put your seatbelts on.
Rob, will you chuck that one in on your side? Have you been on one of these before? Yeah, spot on. All monitoring, oxygen off, just for the purpose of getting down, because it's going to be easier. Pop this off your mark, mate.
Yeah. What happened?
What's happened?
Yeah.
I think you've took something, mate, and you've took a bit too much. Has that happened before to you?
No.
No. Do you know what you've took today?
No.
Okay, mate. Are you two happy at the foot end just to get over the lip on that metal bar? Yeah, over there?
Yeah,
Is that all right?
Okay, just to be aware, we do have reducing GCS, smaller pupil sizes, and we are sweating. So if we can go, now is our opportunity.
Okay.
Let's all go.
There are now signs the Narcan is wearing off, and the drugs the man's taken are once again overpowering him.
Keep your hands close together, just so you don't bang your elbows off the door frames. Get your hands together, mate. Squeeze through. Ready, set, left.
Okay. Down. So then bars away?
Yeah, bars away.
Spot on.
Paramedics accompany the patient in the lift, while the critical care team take the stairs.
The antidote doesn't work for as long as heroin lasts for, so at some point that's going to wear off and he's probably going to land back in the same situation. So he'll need to go to hospital for a period of monitoring and potentially repeated doses of this medication.
I ain't going off for it.
The patient will be taken to nearby Heartlands Hospital, where medics will be able to closely monitor his recovery and provide any further medication he needs.
Can go to, heroin overdoses quite a lot. So it is a massive impact on the ambulance service. But what's the answer? He's not taken that specific amount for the purpose of stopping himself breathing or killing himself. He's not taking it for that. He's taking it because unfortunately that's his addiction. He's still a patient. So, we'll turn up every time. We'll do our bit every time. It's all kind of part and parcel of the job, isn't it, really?
The Midlands Air Ambulance has 3 helicopter teams stationed across the region, serving a population of 6 million people. And when the helicopters can't fly, a fleet of fast response vehicles is on standby.
Yeah, go on.
At RAF Cosford, Dr. John Bingham and critical care paramedic Jack Lewis are preparing for the start of today's shift.
This is the active bag that has the drugs in it, so should we just put that on the car?
Bags packed, they're ready to take their life-saving skills wherever they are needed.
We're going to save lives and save time.
Ambulance service, is the patient breathing?
I don't know because I can't see him. The door's shut and this will open it. I've just had a phone call to come and check on him. None of his family can get in touch with him.
He's an old gentleman.
Yeah, he's going to be in his 70s. I've just peeked through the letterbox. I can just see his leg. He's right behind the door. I think he's fell over.
We'll get to you as soon as we can, all right?
We're about 6 minutes ETA.
An elderly man has fallen down the stairs in his home. He's unconscious and it's thought he's been on the floor for hours without help. Jack and Dr. John are dispatched by road.
We're going to a job with a patient who's fallen down the stairs and is unconscious. It seems like it's going to be a head injury trauma.
The fire brigade have had to break into the house, and an ambulance crew are giving first aid.
It seems like the land crew who are in attendance are having difficulty maintaining the airway.
If the man's airway's obstructed and oxygen can't get to his brain, he could die within minutes. The specialist skills of the critical care team are desperately needed.
If this gentleman does have a head injury and is essentially unconscious, he is at risk of what we call a secondary brain injury. So if we don't maintain the oxygenation to his lungs and to his brain, then actually the brain injury he's already got will get worse. There we go, visual.
Reached your destination.
Should we just take the red bag in case to
Red bag of PPE,
Yeah.
If we need anything else, I will come back for it.
By the time Jack and Dr. John arrive, paramedics have moved the patient into an ambulance.
Hi, how you doing?
77-year-old retired warehouse manager Mick is barely conscious, cold, and his breathing is weak.
Give us a quick rundown of what's going on.
That was been found behind the door.
Yeah.
Bottom of the stairs. We've gone down the stairs. We picked up what last night was last seen.
Yep, he's frozen, isn't he?
Yeah. There was no response on the patient.
The Glasgow Coma Scale, or GCS, is a way to assess a patient's level of consciousness.
1, so verbal, I guess that's a 1. Motor, we look like we might be localising on that one side. So 5, so 7 at best.
Mick's low score of 7 out of 15 could indicate a major head injury from the fall down the stairs.
They'll probably put him off to sleep and get him up to Stoke, I would have thought.
Mick urgently needs treatment at a major trauma centre, but there's a concern he might not survive the journey.
Roughly by land, how far are we from Stoke?
Probably 30 minutes.
Dr. John and Jack make the decision to take over Mick's breathing.
So John, do you want any drugs? I'll do a kit dump, get to some level 3 and we'll go from there.
That way they can maintain essential oxygen supplies to his brain and vital organs.
Just going to RSI this gentleman.
It's a procedure normally only done in hospital, but the critical care team have the expertise to perform this life-preserving action at the roadside.
So he could be a tricky airway just because of the vomitus and the facial hair, but I still think he should be manageable.
Very happy to have a first look.
Absolutely, mate.
Jack and Dr. John will need to work closely on Mick's airway, so put on full PPE.
Just watch that right arm. We're going to need a good pre-oxygenation. And then I've got checklist ready as well whenever. OK, so oxygen supply. IV fluid is running. Suction working. Ketamine is going in, followed by rocuronium 80.
Dr. John administers ketamine to put Mick into a deep sleep, and the muscle relaxant rocuronium bromide to enable Jack to insert the breathing tube.
You okay?
Yep. Lots and lots and lots of vomit.
Vomit is removed from the airway with suction.
Can you see anything useful?
Epiglottis.
Epiglottis?
The epiglottis is a piece of cartilage that covers the windpipe.
There is a bougie handy whenever you're ready.
Yeah.
Bougie's in your hand.
To find a way past it, Jack carefully inserts a flexible tube called a bougie.
Take your time, mate.
Yeah, that's through the cords. I'll do that.
Size 8 tube is coming down. We've got the bougie.
I've got the bougie.
Now they can reattach the ventilator bag, which will deliver life-saving oxygen direct to Mick's lungs.
Cuff is up.
Got the waveform back on.
CO2 on the monitor.
Yeah, good waveform, not deteriorating.
Suction off so we can hear.
Chest movement.
Looks good. Blood pressure's just reading.
The procedure has gone smoothly. Now Mick needs to be stabilised.
Sounds good, doesn't it?
We've got misting.
We need to secure the airway. Let's secure this in place. Fluid's running in it.
Blood pressure readings failed.
Failed, OK.
Suddenly, the patient's condition deteriorates.
I can't find a carotid pulse. I think I'm going to declare cardiac arrest, John.
Mick's heart has stopped.
I've got no output at all.
If they are to save his life, Dr. John and Jack will need to call upon the full extent of their critical care skills.
5. Trying to move, Roy, trying to move. There we go, good man.
In Hales Owen, Dr. Ewan and Peter are treating Roy, who's detached part of his scalp after falling at home and hitting his head on a cabinet.
Do you want to pass me the blocks behind you there? We can stick that on now as well while we're still not secured. Nice and buddy, thank you.
The wound is bleeding heavily, and the team want to get Roy into an ambulance quickly before the latest dressing fails.
I'm just going to strap your arms in, all right? While we get you down the stairs.
Have you got any numbness or tingling anywhere? Squeeze both hands.
Numbness or tingling in the hands can be an indication of a spinal injury.
Squeeze both hands. And the other one. And this one. Why not?
Previous stroke.
Okay, yeah, nice one. It's good to know.
Although dazed, Roy does not seem to be experiencing any loss of sensation. The scoop is placed on a carry sheet.
Ready, steady, slide.
Which should make the task of navigating the narrow stairwell more manageable.
Ready, steady, slide.
That's fine, we're good. Hang on, let's get off it. Okay.
Ready, steady.
Good.
By the time Roy is down the stairs...
So I can see that's seeping through, so we might need to get some compression on there.
Blood is beginning to seep through his bandages.
Pete, do you want to just stick your hand behind his head and just put a bit of pressure on there while we're moving him?
With a 20-minute drive to the hospital, the current dressing won't be enough to control the bleeding.
How are you, Anne? What would you like to do?
So I think 20 minutes with it slowly seeping through is probably going to amount to a decent amount of blood loss, isn't it? So.
Excessive blood loss could cause Roy to become dangerously weak and require a blood transfusion.
I think what we probably ought to do is get our surgical stuff out and maybe we'll just stick a suture in and put it together. You happy with that plan, guys, yeah?
Yeah. A suture or stitches will secure Roy's scalp in place and contain the bleeding. It's an advanced technique that can't be undertaken by ambulance paramedics, so Dr. Ewan will carry out the procedure.
You all right there, Roy? You okay?
Just relax for me, Roy.
So the plan is we'll log roll, keep hold of the head. The doctor will suture the back of the head as needs be. We'll redress, we'll have the dressings. If he gets sick, we'll manage him getting sick on that side. Are you all happy with that?
Yep. Ready, steady, roll.
Relax, Roy.
Okay, so you got it? I'll just take that away, look.
Peeling back the dressing reveals that a large section of Roy's scalp is completely detached.
Go ahead.
They're just having a look at your head, Roy.
Yeah, I've had all big operation.
I think, Pete, I'm going to have to just staple this, mate. I'm going to stick a few staples.
Absolutely. If you want me to put my hand somewhere, keep going on the head.
Yeah.
Ewan had planned to stitch the wound up, but the bleeding is too severe. Instead, he is going to use surgical staples, which are stronger and can be applied more quickly.
Right, this is going to be a little bit sharp for a second, I'm afraid. Are you okay?
Nice and still.
There'll be a small pinch.
Well done.
Even for a patient with reduced consciousness, it's an uncomfortable procedure.
Well done. Well done.
The staples are a temporary measure to keep Roy stable for the duration of the ambulance journey.
You okay there, buddy?
Yep.
You sure?
Yep.
Without them, Roy could lose so much blood he'd become dangerously weak.
Well done.
Once in hospital, the staples will be removed and replaced with more precise stitching.
How's it look underneath here?
There's a big hole there.
Okay, so if we just move your hand a little bit.
Yep.
Right, let's see the damage here there. Okay, how's that look now underneath there? Any big bleeding bits still?
Down to your right where my hand is.
Let's just move your hand a little.
Nearly done.
Hang in there, Roy. Last couple.
That's all right.
And I think what we'll do then, guys, is we will do exactly what you did first time and just redress it in the same way, and hopefully that'll just be enough to stop the bleeding.
What did you want to happen there now?
The combination of staples and a conventional dressing on top should be enough to get Roy to hospital safely.
Sure, just keep your head steady. If you just chuck the new blocks in, if they're just a hand.
Drop your head back down. Okay, good job.
Now, what are you saying, Yuan? You think you can clear in a minute?
Yeah, if you're happy, I think there's nothing else we're going to need to do on the way in. I think as long as the crew are happy, so I was just saying you're able to just quickly make sure the crew will be okay with that. But
Now that Roy's stabilised, he can be left in the care of the ambulance crew, freeing up Ewan and Peter to attend another emergency.
High control, we're available to clear if you have another job for us, over.
So what I've done then is I've put over 10 surgical staples in there. What I would suggest is on the way in, what I do is stick one of your hands underneath there, that's where it's bleeding from, isn't it? And just really go hard on the pressure. That's it, just really, don't be shy, just go for it. Is that okay, guys? Yeah, you happy? You happy? Is that all right? That's fine. Thanks very much, guys. Good job. Take care of yourself, Roy, okay?
I'll get have a shit.
That's okay, you can do that.
While Ewan and Peter set off for their next job, Roy will be taken to Birmingham's Queen Elizabeth Hospital, where specialists can treat his wound.
But wounds that big very rarely stop bleeding until you can pull the skin over them, from my experience. So, especially people who are a little bit older, they can just keep bleeding, and in that case he might have got to hospital having lost quite a significant amount of blood, and he might then have needed blood transfusions, or he might have lost consciousness even more because of the blood loss. So I think patients can deteriorate quite quickly, so hopefully we've prevented that and given him some stability on the way to hospital now.
PPE, helmet and gloves.
On the right-hand side of the car.
On shift tonight in Birmingham are Dr. Simon Meredith, paramedic Rich Smith, and consultant nurse Andrew Thurgood.
Yeah.
Parapack ventilator.
Checked in the back of the vehicle.
Carry sheet.
Yep, in the vehicle.
We've got blood, so we just need to book on and fill out our form.
Who collected the blood? Hold on.
With advanced equipment and a range of skills at their disposal, they're prepared for whatever the evening may throw at them.
Oh my God! The service is the patient breathing. The patient's breathing. The lady's in labour. The baby's head's here. She's in the hallway. Okay. She's downstairs, outside. They've pulled her back into the foyer. The baby's out. The baby's out. We need Okay, I'm going to get that sorted for you. She's not crying.
A baby has been born in the cold outside a block of flats. First reports indicate that the newborn may be having problems breathing.
Not good.
Baby born in the street.
Yeah. Yeah, that's all received, mate, thank you.
An ambulance is en route, but with both mother and baby potentially at risk, the critical care team are dispatched.
What do you want to do, mate? There's a crew just booking in.
Let's do a really quick split. Do you want to quickly have a look at baby? I'll have a quick look at mum.
Okay.
We'll decide who's poorly.
Exposure to the cold and a lack of medical facilities mean that time is of the essence.
If we are going to have two patients, I'd like to have the blood, or at least be able to get to the blood quickly.
Sudden births can increase a mother's chances of hemorrhaging, losing consciousness, or even going into cardiac arrest.
There's another ambulance. That'll be our ambulance. Seconds away.
Can you see anybody on the outside?
No.
No.
No sign.
All right, I'm just going to turn around quickly.
Arriving on scene at the block of flats,
Can't see anybody on that bus.
they now need to locate mother and baby fast.
27, 28, 29, 30.
In Stafford, critical care paramedic Jack and Dr. John are attempting to save 77-year-old Mick, who was found unconscious in his home after falling down the stairs.
Well, that looks like, I saved the F, but it's now becoming increasingly systolic.
Jack and Dr. John had just inserted a tube down Mick's throat to ventilate him when he went into cardiac arrest.
Right, we have got a SATS reading of 95.
Now Jack's applying chest compressions to keep the flow of blood and oxygen going around Mick's body until his heart can be restarted.
Just go nice and gentle. Fluid is running. 1 milligram of adrenaline going in.
Dr. John administers adrenaline, which will help stimulate Mick's heart muscles back into action.
Not convinced.
It's now 4 minutes since Mick went into cardiac arrest. Dr. John takes over the chest compressions.
Adrenaline is in. Compressions are on. Airway's obviously good. From a breathing point of view, it feels nice and easy to bag him. CO2 is going quite well. Fluid is actually running in at the moment. 3, 2, 1. Checking. Probably. I can't feel a carotid, and that looks like a PEA, possibly.
PEA, or pulseless electrical activity, means Mick's heart is producing an electrical signal, but it's still not beating.
Second adrenaline just going in there. Second adrenaline in. Could someone grab the Lucas device out of the side of our car?
Jack and Dr. John decide to fit a Lucas machine.
Ready, say lift.
This will take over chest compressions and mechanically pump Mick's heart in a strong and regular rhythm.
So essentially 3 minutes into this cycle, so do another 2 and then we'll do a rhythm check.
Every 5 minutes, the chest compressions are briefly stopped to allow the team to check whether Mick's heart has restarted.
Oh, yes, pulse.
Finally, after 11 minutes in cardiac arrest, it has.
Very irregular.
Mick's heartbeat might be faint, but it's there.
Question is going to be, we need to start thinking about driving up to Stoke.
Now Jack and Dr. John need to get him to intensive care as soon as possible.
But it does make sense for us to start thinking about moving, doesn't it? We're on a ventilator, we're on a Lucas, we keep going. So I'll give them an ETA 30 minutes at best.
Dr. John radios control so they can brief the Royal Stoke Hospital's cardiac care unit.
060. I need to give you an update to pass to Stoke when you're ready. Over. GCS at best 7. We arrived on scene to find him obviously unconscious in the back of the ambulance, mouthful of vomitus, SAT's not reading because of hypothermia. Performed a limited RSI, but shortly after that he arrested, went into PEA and asystole alternating, requiring adrenaline, and now has a ROSC as of about 2 minutes ago received. ETA approximately 30 minutes.
Against the odds, as they arrive at Royal Stoke A&E, Mick can be handed over breathing and with a stable heartbeat. Now his treatment and care will be continued by the hospital team.
The crews have found him in a very unwell state, who with an unknown downtime following a significant mechanism in an elderly man who is not well, and for all those reasons they made a good call to ask for support, and we were able to arrive on scene and deliver critical care interventions that he needed right there and then. So despite his cardiac arrest and his complications, we've managed to get him to the hospital with his heart beating, with his blood pressure in a good place, ready for the next stage of his treatment.
Got the primary. I'm going to go and do a recce.
In Birmingham, Dr. Simon and his team are outside a block of flats where a woman has just given birth.
How are we doing, guys? You all right?
An ambulance crew have managed to locate mother and baby and have put them onto a trolley bed.
You, Dad? Hello, mate. Christmas come early for you? Yeah.
New mum Kaylee and her partner David were on the way to hospital, but baby couldn't wait. Kaylee gave birth onto the tile floor of the entrance to the block of flats where she lives.
Dad, just jump on the back of the ambulance here for us, mate. All right? Okay, get on side, leave the kit outside, quickly tell the doc, see if you want us, and we'll get ready to go if you want.
The ambulance crew member who was first on scene updates Dr. Simon.
So this young lady was about to get in the car on the way to hospital because of the contractions. Has now delivered baby in the foyer of the block. Baby's out, baby's healthy. Fine. Good filler. Good. Not got any concerns, we've heard baby cry. Cord is still attached. We're just about, well, give it 5 or so more minutes and we're going to cut. Okay.
For now, the baby's left attached to his mother by the umbilical cord, which helps establish good blood circulation.
Mum okay? Mum's fine. The missus just dropped the baby on the cold tile floor. Yeah. No bleeding. No bleeding. No bleeding.
And last time you looked at
placenta? Yeah. Not yet. Not yet.
Okay. Do you want the second crew to wait for baby, or are you going to travel both together?
Potentially both together. We'll keep second crew for now.
Now, that sounds good.
Do you want to have a quick look?
Yeah, have a quick look. Otherwise we're here.
Just have a quick pop in and say congratulations.
It appears the birth went smoothly. However, Dr. Simon wants to be sure.
Hello. Congratulations. What are we? What flavour?
We're a boy.
Mum, how are you feeling? Other than a bit shook up. All right. I just want to have a quick check and know that you're not bleeding a lot. Is that all right?
As the crew prepare to cut the umbilical cord, Dr. Simon checks Kaylee to rule out immediate complications such as tears or excessive bleeding.
That is all looking absolutely peachy.
Peachy.
That is going to be fine.
Aside from being a little shell-shocked, mother and baby seem to be in good health.
Fine.
Everything's good, yeah.
What are we going to be called?
Arlo.
Harlow.
Yeah.
Lovely. Help him stay warm. So, well done.
Thank you.
The ambulance crew will now transport baby Arlo and his proud parents to the local hospital for further checks.
Absolutely fine.
Yeah.
Looking lovely. They're just going to get skin to skin.
For Dr. Simon and his team, it's the best possible outcome.
We arrive and find a healthy mum and a healthy baby being put into the back of the ambulance by the crew. Childbirth is a very natural process, so we can overthink it and over-medicalise it. And it's just nice to see that that actually is the case in this situation. Mum's doing well. So, yeah, good news all round.